My name is Tung Pham. I am the second year PhD student in the Cancer AP program at the Harvard School of Public Health. So when I was a medical student, I have a chance to join an exchange study for 10 weeks to Sweden. So in one of the seminar, we were talking about cervical cancer prevention. And many of my friends from other exchange programs, they came from Europe. They speak about what program they have in their country, what is the payment system look like. And only me, another Vietnamese student and another African student, we just sit in the room with nothing to say because we don't have sub-program in our country. And that experience really changed my perspective on how healthcare should look like. When coming back to Vietnam, I went through my oncology rotation. I see that most of our patients in Vietnam, they came at a very late stage. There's nothing really we could do for them at that point. At that point, I feel that if I continue to be a physician, I could not deliver what I want to deliver for the patient. And that is when I shifted my focus to public health and cancer prevention and cancer epidemiology. So one of the things I got looking into is the intersection between lifestyle and genetic in the determinant of cancer risk. So what I'm particularly interested in is the high risk group of cancer patients. For example, if you have a family history of colorectal cancer or breast cancer, so what kind of lifestyle change you could do to decrease your risk compared to the normal population? So during my medical school, I also joined to some research project, and I was in charge with designing the questionnaire and research tool for this research. So I began to searching online for questionnaire on various topics. And one of the things that consistently show up is a questionnaire from the Nerd Health study of the Harvard School of Public Health and Harvard Medical School. The questionnaire was very detailed and it would clearly formatted, and that leave me on strong impression that is a very strong program, and I really want to come to learn on how they do all of these cohort. That is really something I was interested in, and I really want to learn on how all of the cohort being implemented, so I can take some of this knowledge back to Vietnam to implement a cohort of similar size in Vietnam. The best thing I like about the Cancer AP program is that they have a very strong cohort study, that is a nerd health study and the health professional follow-up study. And the thing I like about the cohort is when I first come to the cohort meeting, I can see people from all over the world they can call in from other country, collaborative to get the cohort data to make the best out of all of the variable and outcomes that we are looking at. I feel like the Cancer AP program here really foster a strong collaboration. And that is how we can bring about the results that truly have an impact on public policy.